Oh. Yeah.
Okay. Okay. Hi, everyone. Thanks very much for joining this Zoom webinar with us today. And so this is the second open dialogue that we've hosted from the Global Health and Development Programme. Earlier this month, we had an open dialogue with Professor Keiji Fukuda, who talked with us about some of the political, economic and social challenges that we're facing during this current outbreak. And this time we have an open dialogue with Professor Ben Cowling, where we'll be focusing more on the various containment and mitigation strategies that we're seeing in response to COVID-19. So before we start, I'm going to hand over to Professor Keiji Fukuda to start with, who will talk a little bit about why we're doing these webinars and then introduce our speakers.
Thanks, Danny, and welcome everybody. As Danny mentioned, this is our second webinar, and we're quite excited to have Professor Ben Cowling deliver the opening talk. Professor Cowling is world famous for his work in influenza. He's one of the world's leading epidemiologists and modelers on influenza, and also a world expert on COVID. And he is probably a name that you've seen in many of the articles or news stories that you've been reading. And then Ben is going to be followed by Dr. Ryan Ao-Young. Ryan is the head of our new BASC, which he'll explain, program in global health and development. What I wanted to just say in a few minutes was to let you know why we're combining these two things together in a single webinar. The current COVID situation is literally an event that none of us have seen in our lifetime. We've never really quite experienced anything like this in the world. And it is something which is of concern to literally every person in the world. But the reason why we're addressing it in this forum and in this way is that this, probably more than any other event that I can think of, really demonstrates how health is closely linked with so many other aspects of life. And so politics, economics, the psychology of society, businesses, how people are spending their life and spending their time in the day. And it literally is touching upon everything that we are doing in the world, in virtually all countries in the world. And this is very much the approach that we have taken towards teaching public health at the school by developing this new program. And so Ryan is going to explain that a little bit more later on. But anyways, I want to turn it over to Ben, and I think you're all looking forward to hearing his talk. So Ben.
Okay. Yes, it's going to be great. Thank you very much, KG. So I am Ben Cowling. I'm an epidemiologist, and I work particularly on infectious disease epidemiology. That's the study of infectious diseases in the community, how they spread, who gets infected, how does infection spread, how many people get affected, and what's the consequences of that, and then how do we control the spread of infections in the community? What are the different ways we can do that? I analyze data that I collect myself or other people collect. I get all the information together and then look at it very carefully with specialized methods to try and figure out what's actually going on underneath the numbers. And the evidence that I generate is then used by public health officials and government officials to make decisions about what to do next. So an example of one of the earliest analyses that I was involved with, I don't use my computer for analysis very often because I got a lot of different things to do. I spend a lot of time talking to people now, but I do get my computer out sometimes and do some number crunching. And one of the things I did in January was this top left panel here. That was drawn by me on my computer. So what I had a look at is for COVID-19 patients, see when they might have been exposed to coronavirus infection. Maybe they were people who had been in Wuhan sometime in January and then traveled somewhere else and then developed symptoms of coronavirus. So if they'd been in Wuhan on January the 4th, 5th, and 6th, and then they got symptom onset on the 10th of January somewhere else, then we know the incubation period is something like 4 days or 5 days or 6 days. So we use that information from a lot of people and then work out what's the incubation period. On average, after people have been infected, how long until their symptoms appear? And that's shown in this panel A, this top left here. So on average, maybe 3, 4, 5 days would be quite common, less likely to be more than 7 days, and very unlikely to be more than 14 days. And that information is directly relevant for the quarantine period. So you know now if you come back from overseas, you're quarantined for 14 days. That's because of analyses like this that say if you've been infected, it's very unlikely that you'll have a more than 14-day delay until your symptoms appear. I'm just going to talk about a few different things, but I've only got 20 minutes, so I will just go through some of them a little bit briefly, but there's 6 different things that I would like to mention. Firstly, in Wuhan, so late in January, myself and my colleagues worked together with scientists in Beijing at China Center for Disease Control and Prevention, looking at what had happened in Wuhan in December and then into early January, how fast were infections spreading, because by that point, we just recognized that infections really were spreading from person to person. Before late January 2020, it wasn't so clear that that was happening. But by the time of 25th, 26th, 27th of January, the information was then available to indicate that infections really were spreading. What we looked at is how the epidemic curve was increasing. So the figure shown on this slide here is called an epidemic curve. How many cases were there with illness onset? Here's the first on the 8th of December, another one on the 10th, another one on the 13th, 2 on the 15th, and so on. And the numbers gradually get larger and larger. It seems like the epidemic's going away after mid-January, but actually that's not the case. It's just that those people hadn't yet been identified. There were more and more and more cases throughout January. And one of the key findings from the analysis of this particular data set, the figure shown here, is in the early part of the epidemic, from mid to late December, cases were rising slowly but surely. On average, every infected person was infecting 2.2 more people. So that meant at some point there might have been 10 infected people, and then from those 10, there'll be 22 secondaries. And then from those 22, there'll be whatever, 44. And then from those, more than that, actually more than 44, because 22 times 2.2 is more than 44. Anyway, you get the idea. Slowly but steadily increasing. That's called exponential growth. There's a very famous story from India about a king who really liked to play chess and challenged all his visitors to play chess with him. And a wise man, a sage, was visiting one time and thought it was a good opportunity to make a bit of money, perhaps. So the king said that if his challenger beat him, he'll give him whatever he wanted. And the wise man said, okay, give me a chessboard. The first square on the chessboard, put 1 grain of rice. The second one, put 2, and then every time double it. And the king thought, that's fine, that doesn't sound like very much. You can see what would have happened. So the sage did win, but I don't think the king could pay out. Look at the chessboard. So it goes 1, and then 2, and then 4, and then 8 up here, and then 16, and then 32, and then 64, and then 128. And then you start getting into the high hundreds and the thousands and the tens of thousands and the millions. And there's not enough room on the chessboard for all of the rice grains. So the thing about exponential growth, it starts off very small, but it doesn't take long until the numbers get larger and larger and larger. And we've seen that happen with coronavirus, where in some countries in Europe, also in the US, we check the news one day and there's 1,000 cases, and then a week later there's 10,000 cases. And we think it's really grown very rapidly, but actually that's one of the properties of exponential growth, that if it's doubling every 4 or 5 days, then numbers really do rise very rapidly. So this is the idea of the reproductive number. Reproductive number, which we estimated was 2.2 in Wuhan, is the average number of infections from a single infected case. So if the first one infects on average 2.2, then they infect 2.2 each, and then those infect 2.2 each, and so on. And that's going to keep going and going and going. And the reason that we want to estimate the reproductive number is to see how much effort we might need to make to stop infections from spreading. You can see from this kind of figure, if reproductive number is 2, we need to stop half of all transmission events from occurring, and then we can keep transmission to a low level. If the reproductive number is 2.2, we need to do even a little bit more than that. For reference, influenza reproductive numbers may be 1.5, sometimes less. Measles is very, very difficult to control, but it's good that we have a vaccine for measles. Reproductive number for measles is about 20. Very difficult to control, in contrast to something like flu, which is 1.5. One other very critical point to remember when we think about what's happening with coronavirus is what we're talking about when we measure confirmed cases. There's always going to be more people who are infected than we're able to confirm as cases. So in Hong Kong now we have about 800 cases. That doesn't mean we've got 800 infections. There could be a little bit more than that. There could be some people who have been infected and we haven't yet recognized them, may never recognize them. In order to be a confirmed case of coronavirus, firstly, need to develop symptoms. Then need to go and see a doctor or go to the hospital. Third step, the doctor needs to decide to test you for coronavirus. In Hong Kong, we do that a lot. Other parts of the world, maybe not so much. And then the last thing is the test needs to go positive. And so each of those steps, people could not develop symptoms with coronavirus or could get very, very mild symptoms, which they don't really worry about. Even if they do get symptoms, they might just stay at home. They might not go to step 2. They might say, I'm not that sick, I don't need to see a doctor. Even if they do see the doctor for step 3, maybe they won't be tested. And then for step 4, some people who have coronavirus get tested and the test comes back negative. Maybe they haven't got a lot of virus. Maybe the sample wasn't collected perfectly. We know from time to time that there's some people have tested negative and then later on they've been tested again and test positive. So each of these steps is a filter. And one of the main filters is how much testing is actually being done. So that's from step 2 to step 3. And so I want to now talk about what's happening in other countries. Oops, so here we go. So this is a very nice graphic from the Financial Times showing the time passage and the number of infections in different parts of the world, different countries, and how it's progressed over time. And one of the first things we look at is how well or how badly are different countries suffering from coronavirus. How well are some countries doing in slowing it down? We see Italy's overtaken China in terms of the number of cases. US has the most, and they're going to have to change the y-axis soon to go 500,000 for the next step, or 200,000 or 500,000 because the numbers have gone off the graph. Other countries are a little bit behind. When we look at some of these countries, we think that they are having lower numbers. It doesn't necessarily mean they've got fewer infections. It's quite possible that the ordering of countries in terms of the number of confirmed cases is not the same as it would be if we knew how many infections there actually were. It may be that there's some countries have more infections but do less testing, and so they have less cases. Also, we can judge how fast things are spreading. So when we think about what must have happened for infections to come into countries in Europe, South America, Southern Hemisphere, we know that most likely there were some travelers from Wuhan or Hubei province, maybe in January, going to those countries, bringing infection with them, probably in small numbers to begin with, and then infections slowly spreading in the community. I just saw a very interesting news report that Brazil found a lady who passed away, unfortunately, on January the 23rd, has now been tested and found to have had coronavirus. And so that would have been one of the earliest known cases outside of China if it had been recognized at the time, but it wasn't. It's only just been recognized now. So why is it that Brazil could have an infection going back to mid-January, but yet still their epidemic hasn't progressed as far as some other countries that maybe were affected at a similar time? Was there more people going to Italy with infection than Spain or Germany or France? Or is it just something about how many people are being tested, or maybe how many people were infected at the early stages? I mean, those are all questions that we're asking ourselves now in the scientific community. And then the good news for us in Hong Kong and also in Singapore is that we're right down here. We're not treading the same path that a lot of other countries are treading, where they have these exponential increases, doubling every 3 or 4 days or 5 days, rising up and up and up and up. We're treading a much slower path. So we do have now hundreds of cases in Hong Kong, but we don't have the same rapid growth that other places are having. So I want to say a few words about how Hong Kong's managing to do that. So there are two basic approaches when we think about what to do to deal with an emerging infection. One of them is called containment and one's called mitigation. I've been involved in thinking about what to do when influenza epidemics occur or influenza pandemics occur. And there were 3 influenza pandemics in the 20th century. So what should we do the next time? Most of the time we think that containment is not really feasible and we're going to go to mitigation. In COVID-19, there was a lot of early discussion also that containment might not be possible, and we're going to have to think about mitigation and slowing things down. So I want to talk about what those two things mean. Containment occurs when we have some sporadic infections that we don't want to spread. We don't want an epidemic to begin. We're okay if incidence is at a low level. It doesn't need to be 0. We're okay if there's a small number of cases, but we don't want case numbers to grow and grow and grow and grow. So we want to suppress transmission as much as possible. And there's 2 basic ways we can do that in Hong Kong, in Singapore, in other places that are really trying hard to do this. The first approach is called case-based suppression, case-based transmission blocking, maybe. We find cases by doing a lot of lab testing. We isolate those cases, and we also identify who they might have already infected. Those are the people they've been in close contact with, maybe their family members, and we put those family members into quarantine so that if they have been infected, most likely they haven't, but if they have, then we stop any further transmission into the community. And that works really well to break chains of transmission from the cases that we've identified. But because we won't identify every single infection, we also need some help from community measures, public health measures in the community. For example, getting people to stay at home much more often. If they do go out, avoid mass gatherings, avoid crowded areas, wear face masks, do much more hand hygiene. All those kind of measures to slow down transmission in the community as well. So the limitation of containment measures is that they're difficult to sustain for a long time. We've managed to sustain these in Hong Kong for 10 weeks. We're going to have to do them for longer. Mitigation on the right-hand side of this table is when we have a situation that there is growing cases, there's more and more and more cases. We kind of give up on containment if we're thinking about mitigation. We say, let's not do the case finding, the isolation, the quarantine, because there's too many cases to be able to do that. We'll try and slow down transmission with social distancing, get people to stay at home more often, maybe close schools, maybe close workplaces, wear masks, hand hygiene, all those kind of things to slow down transmission as much as possible. And mitigation measures are also difficult to sustain. This is the concept of mitigation. So look at the green epidemic. This is the kind of thing that would happen perhaps if we don't do anything, if it's a pandemic, maybe a flu pandemic, maybe COVID-19. And then if we can do our measures, school closures, stay at home, workplace closures, wash your hands a lot more, wear a mask, we'll reduce transmission. So we'll slow down the speed of spread. We'll delay the time until the epidemic peaks, and we'll reduce the height of the peak. And the peak is a particularly important thing to be concerned about because our health system only has a limited capacity for people to be sick at the same time. So in Hong Kong, we have 40,000 hospital beds, which need to accommodate patients of lots of different types. If we have 1,000 people with coronavirus, we can manage it. If we have 10,000 people with coronavirus with 40,000 hospital beds, most likely we can still manage. If we have 100,000 people with coronavirus, it's going to be problematic for the hospitals. So we want to spread infections out as much as possible. So you see here, the red line is the health system capacity. We understand that we may not be able to get below that. If we're mitigating, we'll try as hard as we can to spread out as much as possible, to flatten the curve. It may still exceed the health system capacity at some point. In the early days of COVID-19, there was a lot of discussion about mitigation. Let's try and slow this thing down. Let's try and flatten the curve. But then some scientists came up with some arguments about why that might not be a good idea. So this is the problem for COVID-19. Look at the red line. For COVID-19, the red line is very, very low. What it means is, if we attempt to mitigate COVID-19, we may have a lot of people who are sick at the same time, even if we flatten the curve, and it may be too many for the health system to cope with. And we've seen that happen in Wuhan first, in Northern Italy, in New York now, in Spain, other places. And that's what now many, many countries are trying to avoid. So they don't want to get into an epidemic because it's really difficult to stop at that point. You need to do lockdowns, you need to slow things down really, really aggressively. So if I could say where Wuhan was in terms of this curve, I guess Wuhan was just on the left-hand side, North Italy was on the left-hand side when they did lockdowns, where the mouse is pointing. If they allowed epidemic to go on and on and on, it would have really been catastrophic health impact. So that's why we're trying so hard to keep the epidemic out in Hong Kong. What's the situation locally? We have a lot of cases in the past month, mostly imported. That's blue on this figure from the Center for Health Protection. When we go back to January, we did have some imported infections, people coming into Hong Kong who'd been infected in Wuhan or Hubei province, came into Hong Kong. There was a little bit of spread into the community. We were able to slow that down. And then as time went on in January through to early February, the numbers were coming down. We were doing pretty well. And so then from early March onwards, we had a lot of residents returning from Europe, from the US, other parts of the world with infection. Of course, there was many thousands, tens of thousands of people coming back. Only a small number were infected, but those are enough to make a big difference locally because we have so few infections locally. And there's been a little bit of spread into the community. Hopefully that's going to tail off a little bit. So what have we been doing in Hong Kong to keep on top of things? We've been doing a lot of testing, more than 1,500 samples some days, and the capacity has been increased even more than that in the past week or two. We isolate the sick in hospital. In other parts of the world, people who have mild illness are asked to stay at home. In Hong Kong, we put them in hospital until they recover because we can, because we have the capacity to do that. Other parts of the world don't have the capacity to do that. We're still tracing the contacts and quarantining them. And then we're also doing these community measures, the social distancing measures, the school closures, working from home, cancelling mass gatherings, staying at home more, and so on. One of the most interesting things to me is thinking about what role each of us can do to help slow down coronavirus. Because of course, the government is doing a lot. The Public Health Agency, the Center for Health Protection in Hong Kong is doing a lot. It's finding the cases, it's tracing the contacts, it's doing the quarantine. Also, the government's done the school closures, civil servants work at home, stop the mass gatherings. They've had interventions in restaurants and now bars. There's a lot of government measures, but we can also play a role ourselves in slowing down coronavirus, slowing down transmission, so that if we do these kind of voluntary measures, we don't need to do more than that. We don't need, for example, lockdowns. We've been doing surveys of population behaviors for years, going all the way back to SARS in 2003. In SARS, we asked people, do you wear face masks when you go out into the community? 79% in SARS said they wear face masks. In 2009, we had an influenza pandemic, quite concerning. 10% of people said they wore face masks when they went out into the community. Now, in COVID-19, in late January, before coronavirus really got to be a very, very big concern locally with local cases, 75% of people already wearing face masks. That's up to 97.5, 98.8, that's 99% of people in mid-March wearing face masks outside, which is a big difference in Hong Kong compared to many other parts of the world. Also, we see behaviors change. So avoid going to crowded places. Among the respondents to this survey, 61% in January, 90% in February, and then back down a little bit to 85% in March. So this is the current situation. This is our assessment of the current situation. The top panel here shows, firstly, in dark blue, the infections that have occurred locally, and in light blue, those infections that have come into Hong Kong from overseas. What we'd like to do with this data is to analyze what's the reproductive number, how much is infection spreading. So when there's one person infected in Hong Kong, how many people do they then infect onwards? And of course, for imported cases, they weren't themselves infected here, they were infected somewhere else, but they can transmit infection locally. So they count on one side of the fraction, but not the other side. It's important to include them. Also, in the epidemic curve, you see there's a decline on the right-hand side, because some cases, if somebody got sick a couple of days ago, maybe they haven't gone to see the doctor yet. They haven't been tested yet, haven't been confirmed yet, so we don't yet know about them. The yellow line here is using a special method to say what might we be missing, and actually we're missing a little bit. We're probably not missing a lot. So using all of that information, we can estimate the reproductive number and track it over time, and that's shown on the bottom panel. So initially it's high, but a little bit uncertain, came down very quickly in early February, down to about 1. It's gone up and down a bit. There's a bit of noise, a bit of variability that may just be because of the small numbers involved in the calculations. It's been pretty static at 1, and it's gone down a little bit now. And that's good news for Hong Kong. So if we want to stop coronavirus from spreading, we need to keep this reproductive number at 1 or a little bit below 1, because otherwise we're going to see growth in cases up and up and up and up over time. So we're tracking this very carefully. We're updating this every day and keeping a very close eye on where the reproductive number is going, hopefully watching it go a little bit down, keeping a little bit below 1. For the control measures that are in place, there's a fine balancing act in terms of having enough measures to keep this reproductive number down, but also not too many measures that go over what's needed, because the measures that are in place are quite disruptive. So I'm gonna come to the end. I could talk more, I could talk all day, but I want to stick to the time. So what's next? Containment measures are going to continue. We've seen a lot of imported cases in the past month. That's going to subside now as people are already back in Hong Kong. Not so many more are going to be coming back for now. But as the time goes on, we'll see more travel. Maybe travel will pick up a bit. There may be other areas of the world which are affected. And most likely, we will still continue to get cases of infection imported into Hong Kong. We may also see more outbreaks. There was a few recent outbreaks in the community. If we have a big outbreak, for example, one infected person doesn't get identified, infects 50 other people, suddenly our case numbers jump very suddenly. At the moment, we're having just 20, 30, 40, 50 cases a day. It's still possible for the health authorities to cope. If that jumps, it becomes more difficult to stay on top of things. So I think we'll tighten some of the local measures if infections surge, may relax them when infections decline, get a little bit back to normal, but still need to keep a very close eye on what's happening, because I don't think coronavirus is going to disappear. It's going to be around for a while. We do have a total ban on visitors because we know that if we import a lot of infections, that's going to leak into the community and then cause local transmission, local outbreaks. I don't know how long that will be in place. Maybe we can consider in the future to relax that, particularly from other areas that are COVID-free. For example, if Singapore continues doing as well as Hong Kong, maybe we can have an agreement where Singapore and Hong Kong, we can go there on holiday, they can come here on holiday, because we're both doing quite well in terms of controlling coronavirus. But then other parts of the world which have a lot of cases, a lot of infections, maybe need to be a little bit more cautious for that kind of thing. So I'm going to stop there. I'm happy to take some questions if there are any.
Okay, great. Thanks, Ben. So I think we'll open the floor up now for questions. So if anyone has any questions, you can use the Q&A function in Zoom, which should be at the bottom of your screen. If you type your questions in there, and then I'll see them come up on the screen and I'll read them out for you. So we have a couple. So the first one is about the use of face masks, which I think is something that we're seeing more and more in the news. So this one is how can you encourage Westerners to use to wear masks, which can reduce the chance of suffering COVID-19?
Yeah, it's a very good question. So I have actually been talking a lot in the media in the West about face masks. I think the first thing we need to remember is if you stay at home, you've really got a very, very low risk of getting infected. If you go out into the community, you might have a higher risk. If you stay at home, you're not going to be exposed. If you go out into the community, you might have a chance to be exposed. And so the best measure for all of us, if we can, is stay at home more often. But if we do need to go out, surely we'll have a lower risk of being infected if we're wearing a face mask than if we're not wearing a face mask. So it's definitely a good idea to wear a mask, but masks don't provide complete 100% protection. If we were to stay in a crowded area and there were some infected people around and we stay there for hours and hours, even if we're wearing a mask, we might still become infected because masks don't provide 100% protection. They provide some protection. And so the reason that we all do it is because I gave the list of all the public health measures that are being used. And I talked about the reproductive number. Probably in Hong Kong, if we didn't do anything at all, reproductive number would be 2.5. With all the things that we're doing, case finding, isolation, quarantine, school closures, workplace, work at home policies, cancellation of mass gatherings, wearing masks, hand hygiene, etc. 10 different things. Each of those is bringing down the reproductive number to what it is at the moment, which is 1. I'm sure that masks contribute to that. Other measures also contribute most likely a lot. But if we didn't have masks, if we didn't have good hygiene, if we didn't voluntarily stay at home, then the other measures would need to do even more to keep the reproductive number at 1. So I think it's a good idea to wear masks. I understand the main barrier in many other countries to having policies for wearing masks is that the supply is not sufficient, and we have to prioritize the supply for healthcare workers because they really need the masks. And in some parts of the world, there's not even enough masks for healthcare workers. So in the community, maybe people can consider wearing the cloth masks, homemade masks. But as a scientist, I have to say that we have much less information on how well those masks will work, how much protection they'll provide. We know that surgical masks provide reasonable protection.
Okay, great. So the next question is from someone anonymous, and I'm not sure if it's in relation to Hong Kong in particular, but the question is, do you believe that the next outbreak of disease will be coming soon? So I'm not sure if that means, do we expect to see a wider community spread in Hong Kong? But yeah, this is anonymous, so if I've misinterpreted your question, please feel free to let me know.
Yeah, I think in China, we've seen infections went up in January and early February, and then they've come down ever since then. Now they're down at a very low level because the measures to control coronavirus have now been relaxed in many parts of China. There are imported infections that have been identified in China. Most likely they'll be spread into the community, just like we've seen spread into Hong Kong community from imported infections. And most likely there'll be a steady increase in infections in China in the coming month, maybe identified later in April. Maybe then the measures will be stepped up again in China to get on top of that second wave. In Hong Kong, we're still doing well at keeping transmission at a very low level. I don't think we're going to have a big epidemic here, but we always have the risk of outbreaks of infections, like we've seen in the past few weeks, a number of outbreaks of infections. And that's the thing we've really got to keep an eye on.
Okay, so our next question is from Jade, and she's asking, how long do you think COVID-19 will last for?
Unfortunately, I don't think COVID-19 is going away. I think it will be with us for a while. There are 2 things that will hopefully happen that will make it much less concerning. The first is a vaccine. We have vaccines for lots of infectious diseases. Normally, it takes a long time to get a vaccine that works very well and can be used in large numbers. But now, because of the impact of COVID-19, there's a lot of scientists working really hard to find a vaccine as quickly as possible. Maybe in a year's time, maybe 18 months' time, we can have a vaccine that works, and then we'll be able to go back to normal after everybody's been vaccinated. The second thing that we can look forward to, hopefully, is an effective treatment. If we could find a drug that when you give it to a COVID-19 patient at an early stage of illness, it prevents them from getting severe disease, then we wouldn't be so scared anymore about having a big epidemic of COVID-19, because there would be a lot of people infected, but we can use the drug so that it's only a mild infection, and then it's not so much to worry about. The real concern with COVID-19 at the minute is if we were to have an epidemic, there'd be a lot of people sick, and a small fraction of those would be very sick, because it's only a small fraction that do get very sick. But when you have lots and lots and lots of infections, even that small fraction can be still a considerable number. And we've seen the impact that COVID-19 had in northern Italy, of course in Wuhan first, now in New York and some other parts of the world. And that's with still not that many infections compared to the number of people that live in those parts of the world.
Okay, so we have a question from Rachel on the role of testing. So the question is, how important is the role of testing for the containment of the spread, in particular in response to the lack of resources available in other parts of the world?
So I talked about the measures that we're using in Hong Kong to keep on top of coronavirus transmission. And I'll start with the reproductive number of maybe 2 to 2.5 if we didn't do anything at all. By doing the testing, case finding, isolation, quarantine, we bring that reproductive number down to some degree. I don't know, say we bring it down to 1.5. And then with the public health measures, school closure, work at home, stay at home more, wear masks, hand hygiene, we bring it down from that to 1. So we get some reduction in transmission from the testing, isolation, quarantine. We get an additional reduction from the social distancing measures. In some parts of the world where they can't do testing, if they still want to achieve containment, they're going to have to do a lot more social distancing to make up for it. If you have somewhere, on the other hand, like South Korea, which is doing a lot of testing, maybe they can get more out of the testing part. And so they can do less of the social distancing in order to still keep on top of transmission, keep the reproductive number around 1 or below 1. So we don't know exactly how much each of these different measures will contribute to reducing transmission, but we can say for sure that each of the measures has a role to play and add up together so that we're doing enough, particularly in Hong Kong.
Okay, so we have a question here about immunity. So how much information do we have in regards to immunity status from COVID-19, and is herd immunity a possibility?
So at the moment, it looks like when people have been infected, they will develop immunity so that they probably can't get infected again, at least for a period of time. But we've only been able to observe people who are infected with coronavirus for maybe 2 months at most, maybe 3 months in the really earliest infections. So it's still early days in terms of judging how strong immunity is, what happens when people who are immune get exposed again, but most likely they wouldn't be infected again. So it means as the number of infections increase to more and more and more of the population, that means that all those people could get back to normal. They don't need to worry so much about being infected. But at the moment, I showed the figure on mitigation and the health system capacity with the red line. Most parts of the world are trying to avoid having a big epidemic where lots of people would be infected. So most parts of the world are going to be a long way from herd immunity. I saw a quote from Professor K.Y. Yoon earlier today. I saw it on my Twitter because it came up. He was saying that he thought in Wuhan, maybe 5% of people had been infected. That sounds like a reasonable estimate to me. If you want to have herd immunity against COVID-19, probably you need at least 50% or 60% of the population to have been infected, and then there might be herd immunity. Of course, if you have a vaccine, then you need to vaccinate 50%, 60% or more in order to get the whole population protected. We're a long way from that at the moment. So Wuhan is well short of any kind of herd immunity. Other parts of the world, even short of that. I think in the early days, we thought a lot about how could we slow down spread so that we could get to herd immunity without too much health impact. Now we've recognized that that may not be a good strategy. We prefer to try and suppress transmission and not have an epidemic and keep most people disease-free, most people free of infection.
Okay, so we've got another question here that is about masks and a few other things. So we've got a couple of studies in Hong Kong are already pursuing the possibility of reusing masks with few materials for environmental impact. So how effective do you think this would be in countries that are heavily undersupplied with medical supplies? And what's the possibility of this working? So I think this is about the potential of reusing masks and also how this would fare in countries with limited resources. And maybe also we could open this up to KG and Ryan if they've got anything else to add in terms of strategies for lower or middle income countries and how this would fare in countries with potentially weaker health systems.
Yeah, so for me first, I think there's a big uncertainty because most of the research on masks that's been done in the past 15, 20 years, or even before that, was on surgical masks that are made specially for medical settings. So even using in the community, surgical masks. There's much less research on how well homemade masks, cloth masks work, what's the best materials to use, how often do you need to change them or wash them or disinfect them, how long will they last, and what's the degree of protection that you might be able to get by wearing one. So I think those are really hot topics at the moment. A lot of people are working very, very quickly on those exact areas so that we could have recommendations, given that we have a very limited supply of medical masks, surgical masks in Hong Kong and also in many other parts of the world. So we have to look at alternatives, but most likely they will do something which is better than nothing. At the same time, we can't think they're going to be magic bullets in terms of stopping coronavirus transmission, because we've seen in Hong Kong, look how much we're doing. We're doing so many public health measures, so much case finding, isolation, quarantine, and we're only able to get the reproductive number down to 1. So imagine if, you know, we haven't got all those other measures to do, or we're only relying on masks. I don't think we're going to see such a big effect in those other places. Really need additional measures to allow people to stay at home as much as possible and to avoid infections from spreading in the community through people having a lot of contact with each other. And that's really, really going to be difficult in the developing world.
Yeah, the developing countries, as difficult as it is for a place like Hong Kong or the richer countries like the US, it's an order of magnitude more difficult in places in developing countries. If I think about Africa, for example, it is rapidly urbanizing. So you have large cities. A city like Lagos is enormous, and fewer people living in rural areas. And then you simply have fewer resources. And so the health systems have less capacity. The ability to access masks and a variety of technologies is simply much less in a place like Africa. The biggest difference in a positive direction, potentially for some of the developing countries, is that the age structure is different. And so many of the countries in the developing world will have a younger population. So it may be that the overall impact of severe disease will be less in those countries. However, there's now increasing discussion and more observations made that the younger age groups may also have significant levels of serious disease also, certainly more than we appreciated at the beginning. So this is the generic issue which is facing developing countries for a large number of health challenges. You know, COVID just really brings everything together in a very acute way, but same challenges are being felt for a number of other diseases. And so, as Ben points out, it's very difficult. There are no magic bullets. There are no simple ways to think this through.
So I think the other thing that is also important is to really try to work out what actually is fact and what actually is maybe hoax or even spams. So I mean, in the literature or even in the news media, I mean, there has been a lot of proposal on like various ways to reuse masks or use masks in different ways. But sometimes it's really important to really look at the evidence behind and try to differentiate whether those approaches are actually beneficial or not. Because even if you are having a proper mask, but if you use it inappropriately, obviously the protective effect of those masks will be substantially reduced. And not saying that if those approaches are actually wrong, then they will actually jeopardize the interventions that has been in place in the society. So, I mean, from these examples, we can see that it's not just about like whether we have a steady supply of masks or whatever interventional measures that are in place in societies, but it also depends on how these interventions are being carried out. I mean, rolled out by the government and how these are being adhered by the society. And there are a lot of complex issues surrounding COVID, but also other issues in the world.
Okay, thank you. So we've got just over 10 minutes left, so I'll take one last question, and this is to do with immunity again. So you mentioned that immunity can have a good chance to prevent disease and finding drugs. Do you think that antibody treatment is an effective way in treating a disease?
Yeah, sure. So one of the treatments that we do know will work is if we find people who've survived COVID and recovered, we take their blood, we filter it for the good stuff in their blood that help them to recover, and then we give that to a patient who's really sick. Now, it's called convalescent plasma therapy. It's been used for 100 years. There's some problems with doing it. It doesn't always work. And also to treat one person who's very sick, we often need maybe 5 or more people who've recovered. And it's a bit of a process. It's a little bit difficult to do it. So we can't do that at a large scale, but we can use it in some cases. I think it's not a solution because we can't do enough of that kind of therapy for now, but it is one of the options available for treatment. But there are limitations to doing that. It doesn't always work as intended. We'd rather have a drug that we could give. That would be a better long-term solution for treating severe cases.
Okay. KG or Ryan, did you want to add anything? Or?
Yeah, just to extend what Ben said, so using plasma therapy is to take the plasma or take the blood from people who've recovered. There is a lot of work going on in manufacturing or looking at antibodies, the monoclonal antibodies, as another potential way. So it's really going a step beyond the plasma. And so there are a large number of antibodies which have been identified which react against the COVID virus. And it's possible that some of them actually neutralize the virus. And so there has been attention on a smaller number of antibodies which can do that. But like all of the therapies right now, they remain experimental. We don't have any approved drugs. So there are traditional drugs which are undergoing trials right now, but none of them, including the immunotherapies, have been licensed for use yet. And we keep stressing the importance of these trials because we know from other outbreaks, and particularly outbreaks like SARS, we often think that we have a good treatment and people use it because at times you get desperate. But then in retrospect, we find that they're either not effective or in some instances, they've actually harmed people. So steroids were used widely during SARS, and then we know that in addition to not being helpful, it really harmed a lot of people. So this is one of the things which we're always worried about.
Okay, great. So thank you everyone for all of your questions, and I'm sorry that we didn't get to all of them, but we are running out of time. So I think in the last 10 minutes, I'll hand over to Ryan. He's going to talk a little bit about our Global Health and Development Programme, and then hopefully we'll have a few minutes at the end if you have any questions about that programme, then we'd be happy to answer those too.
All right, thank you very much for staying with us, and hopefully you have learned a bit more about the COVID-19, which is very fluid and still like we're learning a lot, from emerging evidence. So as KG mentioned, one of the reasons why we embed the webinar with this BASD GHD program is because we see that nowadays when we are talking about global health issues like COVID-19, it's more than just a health issue, it's interlinked with essentially all sectors in societies and even in the world. So that's why we think that it will be useful to take this opportunity to really emphasize the importance of this program in tackling future or existing global health and development problems. So just within the context of COVID-19, I mean, for those who have attended the previous webinar, then you'll see that these headlines are different from the ones that I just shared, because this reflects like what has been going on in the society. As Professor Ben Cowling has mentioned, there are multiple ways in dealing with the containment or the mitigation of, say, COVID-19. I mean, we might consider, say, shutting down like premises, and recently the government has already announced shutting down karaoke, mahjong parlors, and are we still trying to do additional things to further lower down the reproductive number? So it all depends on emerging evidence that are conducted locally and also elsewhere. So obviously Hong Kong has been doing quite well, I mean, in comparison to other countries. So I mean, one of the headlines in the foreign media is that whether US, for example, can actually learn from Hong Kong in trying to contain or to lower down the burden of COVID-19 in US. And obviously, when we talk about COVID-19, it's more than just health, and it already impacts substantially on the global market, for example. As for those who follow the stock markets, I mean, you can see that there's a substantial drop in, say, stock prices globally. So obviously, there has been a lot of impact apart from health. So in our school, of course, I mean, we are at the forefront of, say, dealing with COVID-19. So Professor Ben Cowling and colleagues in the school and the faculty actually tries to not only do research, but also try to put up information that would be useful for policy formulation. So for example, the school has recently produced a dashboard to provide like updated information regarding, say, COVID-19 parameters that will be extremely useful for design of policies to contain COVID-19. And of course, we also have, say, academics who are not just working on research, but also trying to discuss with the policymakers in the government, or maybe even at the WHO level, in order to work out strategies to really contain the pandemic. So going back to the BASC GHD program, for those who have seen our website before, this is an interdisciplinary program which involves 6 faculties. And we are using different modes of education, not just lectures, but also tutorials and problem-based learnings and seminars, so that students can actually understand how things work, not just by like reading the books, but actually know by doing things. For the BASC program, I mean, because it's so new, therefore we are introducing courses which has not been launched before. So these include, say, leadership, big data, as well as understanding knowledge from different disciplines. And one of the most important aspects regarding this program is the overseas field placements, because we believe that it is most important and most valuable for students to actually go to the relevant sites to learn how things actually work in practice at forefront of GHD. So these include, say, WHO, UNICEF, Bloomberg Philanthropies, and other relevant international organizations. So speaking of, let's say, COVID-19, within the context of COVID-19, obviously, when we talk about global health and development, there will be issues that we think are very important for students to really comprehensively evaluate and understand these issues. For example, we see that COVID-19 has a large impact on economics. So it's very obvious that students will need to know the basics of economics from the courses offered by the Faculty of Business and Economics. When we talk about, say, containment strategies or mitigation strategies, some people might touch upon issues with regards to law. And therefore, it's also important to know like what are the principles of global health law, and also like whether such intervention or mitigations will have impact on, say, human rights embedded in, say, constitutions in like certain countries. Professor Ben Cowling has already elaborated a lot on public health, so that's why this is also one of the core concepts that are being included in the curriculum. So with regards to COVID-19, you will need to understand, for example, the reproductive number, what is the meaning of epidemic curve, and for example, if we look at, say, all these statistics, then obviously you need to understand how these, what are these things and how do we interpret these issues. Since we are social people, I mean, obviously we also have to understand, say, a little bit on social science. So why do people behave in this way but not the other way? Why do we see like politics working in this way but not the other? So that's why social science is also one of the core concepts that are being included in the BASC GHD curriculum. So apart from these, I mean, we understand that in order to drive policies, we can't really just think from one particular perspective. So that's why apart from embedding multiple perspectives like courses in the curriculum, we also have like competencies. For example, how do we lead the team or lead the government or lead the organization to achieve what we think is best for the people? how do we advocate policies. So these are the competencies that you are going to learn from our curriculum. And of course, I mean, Professor Bankala again speaks about like health systems. So why don't we just increase the number of beds to infinity in order to cope with these issues? There are obviously pros and cons. I mean, if we expand our health systems, how are we going to sustain the system? I mean, where are we going to get the funding to fund all this health system to make it sustainable? So what is the role of innovation and technology? So can we actually use information with regards to travel? So for example, our Professor Gabriel Lam mentioned maybe the use of octopus data might help us work out like how to really monitor the situation and what is the role of private sector. I mean, can we actually involve more of the private sector to help drive, say, development of vaccines or even pharmaceuticals? So these are the topics that hasn't been really covered like as much in the past, but nowadays, as we can see and clearly demonstrated from the COVID incidents, then these things are actually very, very important in order to help us to really tackle global health and development problems. So this is just the first snapshot of the curriculum. Similar to other conventional undergraduate program, we'll have a 4-year program where year 1 to year 2 covers the basic concepts from different disciplines like economics, social science, science, public health, and so forth. But for year 3 to year 4, then students will start looking at more complex issues. For example, how can we have a sustainable health system? What is the role of private sector in driving global health and development policies? And lastly, for year 3 summer to year 4 first semester, students will actually go to international organizations to actually work as an intern in those settings to understand how things actually work in practice, so that you might be able to understand like, why is WHO behaving this way? Why is the UN agency behaving in another way? You might be able to find more information firsthand, I mean, throughout the field placement. So as I mentioned earlier, one of the unique features of this program is the overseas field placements, where you will spend 6 months in an overseas organization to do the field placement. So what we want you to do is to actually gain exposure to real life GHG challenges, trying to understand how, for example, WHO tackle issues like COVID-19 or even like other aspects, for example, cancer incidence in certain countries or infectious diseases in, say, underdeveloped countries. So what we try to help you with is to really put theories into practice and to understand the operation of these organizations so that you better understand like how these things actually work, and then try to come up with solutions that are agreeable and feasible. And lastly, of course, I mean, from the field placements, you will be able to gain practical experience and mentoring from staff over there. So I think this is just a very brief outline of the program. For those who are really interested in the program, so please feel free to email us at ghtsph@hku.hk or call us at 3917-9921, or you can just scan the QR code on the screen, which will link you directly to the website of the program. So as with other things, I mean, we also have the social media, so you can follow us on the social media where you can get updates not only for GHT, but also like very relevant information with regards to global health and development issues in general. So I think that's it for my part. Thank you.
Okay, great. Thanks, Ryan. So if anyone has any questions specifically about the Global Health and Development Programme and what that involves, we'd be happy to take them now. So if you have questions, just pop them in the Q&A function, the same as before. And if not, we'll wrap up there. I'll just give you a few seconds. Okay, let me just have a look. Okay, so this is a question about electives. So as a medical student from the UK, and current elective plans for early 2021 kind of uncertain, is there a possibility to do an elective in GHD at HKU?
Oh yes, I think that is definitely a possibility. But of course, I mean, given the COVID-19 situation, we need to work out like how this can be arranged, because like we have all these travel bans, and I think even in UK, I mean, we are now having like all this online teaching, I mean, in the whole semester. So we'll need to work out how we can bring this forward, but this is definitely a possibility.
Okay, great. Yeah, I think everyone's travel plans are up in the air at the moment, but yeah, do keep in touch with us, and hopefully that will be an option in the future. And we've just got a question about showing the last page, so I think that's up there now. Okay, great. So if that's all of the questions, I'll wrap up there. there, do keep in touch with us, follow us on social media. We have a GHD website, which you've seen, and we'll keep you posted on any other events that we do in the future. Okay, thanks everyone. Thanks for your time, and thanks you to all of the speakers, and hope to see you again soon. Thanks.
Bye.
Bye bye.